A nation gasping for air. A country searching for answers while hundreds of people are dying, both in hospitals and at home. In July this year, Indonesia had even surpassed India as the new epicenter of the COVID-19 pandemic in Asia.
Tidak menyangka sekali sampai seburuk itu kemarin, sampai harus dirawat dan lain sebagainya. Padahal kami tenaga kesehatan kan sudah divaksin.
The coronavirus pandemic has pushed the country's fragile healthcare system to its breaking point and plunged millions into poverty.
The sense of urgency that should emerge when a country is in a dangerous health crisis had not really developed until it was very late.
With less than half of the population fully vaccinated so far, Indonesia remains vulnerable to new virus outbreaks. Can Southeast Asia's most populous nation overcome its worst health crisis before it spirals out of control? Natalie Clementine, or Ellen, was only 4 when she lost both her parents to COVID-19 in July this year. At that tender age, Ellen may be too young to grieve or understand the full implications of her loss. But not her grandmother, Rita Sitanggang. The deaths of her 33-year-old son, Eldias, and her daughter-in-law, Christina, have dealt a devastating blow to the 62-year-old seamstress living in Surabaya. She can still recall the day when she was rushing to the hospital after being told that her son was having trouble breathing. But only to be told later that her son Eldias was already gone.
Saya tidak peduli, pokoknya mak ngasih naik motor, saya berangkat naik sepeda motor. Dalam keadaan kayak apapun saya nggak takut, saya fokus dengan anak saya percaya sama Tuhan. Terus anak saya bilang, oh, tunggu mak, saya cari informasi dulu, saya dulu begini-begini. Kan karena nggak boleh masuk kan, jadi anak saya, datanglah anak saya, jemput saya yang nomor 2 itu, kita berangkat ke sana. Setelah sampai di sana saya lihat, masuk kita, tanya begini, masuk ke kamar, ke rumah sakit, baru kita bisa masuk ke situ. Ternyata sudah nggak ada di situ langsung.
Eldias and his wife Christina contracted the virus in late June this year. Eldias passed away less than a month later on July 3rd, following complications from the infection. Christina, who was then 4 months pregnant, succumbed to the virus a few days after. In spite of her losses, Rita is determined to take care of her granddaughter, Ellen.
Saya tahu Tuhan izinkan semua ini terjadi, Tuhan juga akan memberikan jalan keluarnya, Tuhan juga akan, yang saya pikir tidak melebihi daripada kemampuan saya. Dan saya percaya Ellen juga anak yang luar biasa. Jadi kita tetap berdoa supaya kita juga tenang, damai sejahtera. Kalau saya nggak tenang, akan nggak bisa berdoa, goncang pemikiran saya, kalut semua, saya nggak apapun nggak bisa saya lakukan. Sementara cucu saya Ellen juga masih butuh perhatian kita juga kan.
The same heartbreaking stories of grief and tragic losses are constantly being replayed across many cities and villages in the archipelago. And they include those who lost their elderly parents to the disease, and children who turned into orphans just overnight. 11-year-old Rara is one of them. She lost her mother when she was still a baby. Her situation went from bad to worse when her father and grandparents died of COVID-19 in July this year. Rara's deaf aunt, Susi Cholifa, now takes care of her in this dilapidated house in Surabaya. Relatives help them with food and school fees for Rara. Neighbors also lent a helping hand, led by neighborhood community chief Jalil Andori.
Assalamualaikum. Kalau menurut pendapat saya dampaknya sangat terpukul sekali. Karena dilihat aja kondisinya seperti gini, perekonomian pun di bawah garis kemiskinan. Ya, saya nggak bisa bayangkan. Apalagi sudah ditinggal sama orang tua-tuanya seperti gini.
For a brief period around May this year, Indonesia seemed to have gotten the COVID situation under control. Daily cases had dropped significantly compared with the peak in January. But in just 2 months, the situation changed dramatically. The second wave of infection spread from the main island of Java to the far corners of the country. It's triggered by the Delta variant, which first emerged in India and is now wreaking havoc in Indonesia. All of a sudden, Indonesia became the new epicenter of the pandemic in Southeast Asia. It overtook India as the country with the highest number of daily infections and deaths. But how did Indonesia reach to this point?
Poor coordination, lack of transparency, and then you have a ham-fisted leadership that is fumbling on how to minimize the impact of a deadly virus to a democratic country of 270 million people, and how to chart a workable short-term and mid-term strategy. Like, Indonesia has been particularly weak on 2 fronts. The government has been late in response, and it has been hesitant in enforcement. So first, it was late in acknowledging COVID. It was late in containing the outbreak in the first months, even when governors were keen to take decisive measures. And then it was late in building systems of testing, tracing, and treatment, even when the virus had killed thousands. It was even late in vaccinations.
The key factor which led to the sudden spike in infection numbers is the Eid al-Fitr celebration in May this year to mark the end of the fasting month. The annual tradition of visiting relatives back in their home villages to celebrate the festival is a mass event known in Indonesia as mudik.
Eid al-Fitr happened also during the pandemic. And at that time, there were widespread announcement, please postpone returning to your hometown, please prioritize the health of your relatives, and so on and so forth. And of course, we see people still going back to their hometowns then, and we still saw many people also returning back to their hometown this year as well.
And it didn't take long before the second wave of infection hit Indonesia. In June, Indonesia recorded its biggest daily infections of more than 20,000. A month later, new cases hit record high at around 57,000, with deaths hitting all-time highs at around 2,000. Overloaded hospitals turned away patients and families who were desperate for oxygen supplies. Many people died alone because they were unable to get immediate treatment.
Indonesia saw what has happened in other countries just weeks before. Indonesia and the rest of the world saw the devastation that happened in places like India. Yet, the Indonesian government was not quick enough in its mitigation efforts. And if we think about the Indonesian healthcare system, it's a system that traditionally has been underfunded. Certainly government spending on healthcare in Indonesia has been one of the lowest in Southeast Asia, if not the lowest in Southeast Asia.
It is impossible for us to stop the transmissions because it is already here. So what we can do is we prepare the hospitals, because our vaccination drive at that time we don't have enough vaccine. So we implement standard protocols, but we know Indonesians are not disciplined culturally, so we prepare the hospital.
Ida Ayu Surya is the assistant front office manager at a family-owned hotel in tourism-dependent Bali. The 40-year-old was infected with coronavirus in August 2021 with her husband and their 7-year-old daughter. The infections within her family had caught her by surprise.
Kayak kaget sih Bu, soalnya kan kita sudah mengikuti prokes, kita sudah istilahnya kayak pakai masker, kayak ya disiplin lah kita, termasuk orang yang disiplin. Demam dulu, setelah itu sama gejalanya sampai akhirnya di hari ketiga ya saya hilang penciuman. Jadi saya memberanikan diri untuk melakukan tes PCR. Sebelumnya saya sudah menerima 2 kali vaksin, itu saya terimanya Sinovac di bulan April ya, yang terakhir. Jadi saya PCR, kemudian dari hasil PCR itu saya positif COVID.
Ida Ayu is not sure how she got the virus in the first place. Although she is now recovered, the disease can still come back to haunt her again.
Kekhawatiran saya sih masih, karena ada informasi dari beberapa teman, mereka sudah kena sampai 3 kali, gitu. Jadi tetap saja ya, saya khawatir karena ya saya masih kerja, jadi pulang ke rumah kayak itu tetap masih khawatir.
Her fear highlights the need for Indonesia to vaccinate more people as a way to contain the spread of the virus. But vaccinating the population in such a vast country is no mean feat. The widening vaccine inequality gap between developed and developing countries have also made the task of vaccinating the entire population a lot harder and takes a longer time to achieve.
Indonesia has also been one of the victims of global inequalities in terms of things such as vaccine access. It's been very difficult for the Indonesian government to access vaccines that have been acknowledged as more efficient, such as the Pfizer-BioNTech vaccine or the Moderna vaccine.
In the meantime, Indonesia has lost hundreds of its frontliners to the pandemic. And that includes doctors, nurses, and other healthcare workers. Can Indonesia take care of the sick and bring down new infections when its creaky and underinvested healthcare system is overwhelmed and on the verge of collapse? Every time there's a major disease outbreak, quite often it's the frontline healthcare workers who would face higher risks of infections through their jobs. Gynecologist Ulul Albab is one of them. The 40-year-old had a close brush with death after contracting the COVID-19 disease just a year ago. And it happened during the first wave of infections which engulfed Indonesia back in 2020. For about a week, Ulu, who works at a hospital in Jakarta, was intubated and was fighting for his life. Air had to be pumped into his lungs after the infection compromised his ability to breathe normally. Fortunately, he survived the ordeal.
Tangis air mata kita nggak tahu berapa banyak yang sudah tercurah karena mendoakan saya. Hampir teman-teman di seluruh Indonesia mengadakan doa bersama buat saya, dan itu sebuah momen yang mungkin menurut saya jangan sampai terulang lagi. Karena kita belum tahu apakah kita akan selamat karena COVID-19 atau tidak. Tapi satu hal yang mungkin perlu kita ingat bahwa COVID ini suatu hal yang nyata. COVID ini adalah suatu hal yang jelas sangat berbahaya. Semua orang bisa terkena, bahkan dokter sekalipun seperti saya.
Ulu says the heavy workload, coupled with the exposure to pregnant women who are COVID positive, have contributed to the high mortality rates among gynecologists like him. Around 2,000 gynecologists have been infected by the coronavirus. More than 50 of them have died so far.
Pasien yang secara data dikatakan bahwa ibu hamil itu 51,9% asimptomatik, tanpa gejala. Di DKI Jakarta, 14,7% ibu hamil itu positif COVID-19. Artinya 10 pasien COVID itu 2 atau 3 diantaranya adalah ibu hamil. Dari pasien COVID yang positif, 10 pasien COVID yang positif, 6 diantaranya tanpa gejala. Tanpa gejala bukan membahayakan, justru malah membahayakan karena ada berisiko menularkan tanpa tahu.
In Denpasar, capital of Bali, I Gusti Ngurah Puttu Jaya Antara works as a nurse at one of the island's main hospitals. He was attached to the isolation room, specially dedicated for COVID-19 patients. In July 2021, the 27-year-old had tested positive for the coronavirus. Thinking that his condition was not so serious, Ngurah decided to self-isolate himself instead of seeking treatment. But soon, his condition worsened.
Sebenarnya disarankan untuk rawat inap, tapi saya menolak karena saya merasa masih kuat untuk isolasi mandiri. Nah, seiring berjalannya waktu, saya menjalani isolasi mandiri selama 4 hari, dan ternyata kondisi saya memburuk pada saat itu. Timbul mulai sesak, kemudian batuk, semakin parah seperti itu. Jadi saya dilawat hampir 8 hari di rumah sakit, ya, sempat perburukan juga, jadi sempat mengalami sesak yang lumayan parah. Tapi sampai sempat juga mencari donor plasma konvalesen sampai seperti itu. Tapi ya bersyukur semua bisa dilewati dengan baik.
COVID survivors like Ngurah and Dr. Ulu are among the lucky ones. More than 700 Indonesian doctors have died since Indonesia faced its first major outbreak in April last year. Ironically, the high fatalities occurred even though the healthcare workers have been fully vaccinated. Since the very beginning of the outbreak, Indonesia had been relying heavily on the China-made Sinovac shots in its vaccine rollout. But the high number of deaths among medical workers have become a source of real concern. That has prompted the government to give booster jabs for its frontliners. Only this time, it's using vaccines made by the US biotech company Moderna for its 1.47 million healthcare workers. The healthcare workers will also be better equipped to help protect themselves against COVID-19 infections.
Most of the Indonesian hospitals are packed with people with the virus, so the potential exposure to the healthcare professionals are very high. We also understand that during the first wave and second wave, not all of them have been vaccinated fully twice. So we haven't been able to protect them 100%. So I have to admit that I'm sad, but then moving forward, and also during the period, we have been aggressively giving extra protections for our doctors by providing them with all the protective suit, priorities in treatment in hospitals, priority access to the rare medicine that is needed.
Health Minister Budi Gunadi Sadikin joined the cabinet of President Joko Widodo in December last year. The former President Director of state-owned Bank Mandiri replaced Terawan Agus Putranto, who has been widely criticized for mishandling the pandemic. Mr. Sadikin is now facing an enormous task of overhauling Indonesia's healthcare system and vaccinating as many people as possible.
I was asked by the president to join this cabinet with three things, three major tasks. The first one is to execute a successful national vaccination programs, which is, as far as I've seen today, is quite successful. The second task that the president gave to me was to overcome this pandemic. This one is slightly complicated. And the third task was to do a major healthcare reform in this country.
Official data shows that daily cases have dropped significantly to below 3,000 in October from record highs of around 57,000 in July. But there are still doubts if the number reflects the true situation outside the main island of Java.
Indonesia never really reached that target of 2 million doses a day. It's far from it. Sometimes, on some days, there would be more than 1.5 million doses, but not every day. So the running average is about 1 million a day or even less. So in terms of that target, Indonesia already missed that target in August 2021.
COVID-19 is taking a devastating toll on the healthcare professionals in the country. Many are risking their lives every day, trying to save those who have been infected by the deadly disease. More than 1,000 of them have died so far in the line of duty. But for healthcare workers who are on the front line in their battle against COVID, backing out is never an option.
Sudah 1 tahun saya nggak pulang ke kampung halaman karena keluarga saya kan di sana semua, saya di sini merantau, di Denpasar, keluarga di Karangasem. Jadi kemungkinan dapatnya pasti dari sini karena saya keluar rumah juga jarang, pulang kerja, istirahat, kerja lagi, istirahat, kayak seperti itu aja aktivitasnya. Jadi waktu itu memang jadi kasusnya juga sedang tinggi-tingginya pada bulan Juli itu. Teman-teman juga banyak yang terpapar pada saat itu karena kelelahan, pasien kami membludak di IGD, ya sampai ke halaman RS kami merawat pasien pada saat itu. Jadi dapatnya dari rumah sakit, kemungkinan karena capean dan memang lagi tinggi-tingginya kasusnya pada saat itu.
Dokter bukan sebuah pekerjaan, Pak. Tapi dokter adalah sebuah profesi. Ketika kita melihat bahwa seorang dokter adalah pekerjaan, maka kita hanya berpikir bekerja. Ketika kita bekerja, pasti kita akan berpikir kapan kita akan berhenti bekerja. Tetapi ketika kita bicara bahwa seorang dokter adalah seorang profesi, maka kita berpikir mengabdi. Ketika kita mengabdi, kita akan berpikir sampai mati, maka kita baru bisa berpikir bahwa kita berhenti mengabdi. Orang akan pensiun jadi direktur, orang akan pensiun jadi pekerja kantoran. Tapi saya tidak pernah mendengar orang pensiun jadi dokter. Karena pasti ketika menjadi dokter, maka dia udah berpikir kapan dia akan berhenti. Makanya jelas kalau kita berpikir bahwa iya, pilihan hidup saya adalah seorang dokter, maka kita akan berpikir bahwa saya akan berhenti kalau saya sudah mati.
Since June this year, the Indonesian government has been struggling to contain the huge spike in COVID-19 cases. Will the health crisis ever end? It's 11 a.m. in Denpasar, the capital of Indonesia's resort island of Bali. Every day at this hour, this communal kitchen is buzzing with activity. Volunteers are busy cooking some basic dishes for those whose income had suddenly evaporated as a result of the pandemic. Each volunteer has his or her own task to perform. Among others, chopping vegetables and meat, cooking, wrapping, and distributing the meal to those in need.
Ini kami buat dapur umum untuk masyarakat yang belum menerima bantuan dari pemerintah, yang memerlukan, ataupun support untuk masyarakat yang melaksanakan vaksinasi. Di beberapa tempat sekarang lagi digalakkan, dipush untuk vaksinasi, untuk masyarakat, untuk semua kalangan. Yang relawan tetap sudah kita buat dari jam 8 sampai jam 10, jam 10 sampai jam 12 gitu. Karena nggak semua orang bisa tahan berada di tempat seperti ini lama-lama, berasa seperti sauna kita di sini ya, seperti itulah.
This communal kitchen receives donation in the form of cash, gas, cooking utensils and ingredients from religious groups, individuals and expatriates. Chefs who have been retrenched because of the pandemic also chip in to offer their services.
Siapapun yang menerima, kalau dia ada waktu, dia perlu, tapi dia ada waktu juga karena mungkin kan tidak bekerja, dia sumbangkan tenaga sebelum dia ambil makanannya.
And that includes a 45-year-old Komang. She used to sell cooked meals to university students and office workers in Denpasar. But the pandemic had forced her to close her stall because she could no longer afford to pay the rent. The communal kitchen in Denpasar has offered a small respite. It has helped ease financial burden of raising her 2 children.
Itu dilawan, kita jalani terus kan. Jadinya utangnya numpuk, jadi saya lepas warungnya. Saya berusaha diam, akhirnya untuk urus anak. Bapaknya masih kerja ya, kayak sekarang gajinya kan dipotong setengah jadi dapat karena PPKM. Ya gitulah, kita dibantu dari sini, untunglah kita dibantu dari dapur umum yang gotong royong, kita juga bantu sebisanya. Kalau kita bisa ke sini, ya selanginlah waktu untuk sini bantu-bantu ya, seperti potong sayur, cuci-cuci apa itu yang disuruh kita bantu selama kita bisa.
Efforts like these may seem pretty basic to some, but they've gone a long way in helping to lighten the financial burden of those who've been deeply affected by the pandemic. And especially for a place like Bali, COVID-19 has completely decimated its tourism industry. From 6.3 million foreign tourists who visited the island in 2019, the numbers plunged to just over 1 million in 2020, just before the pandemic began to spread out of control in Indonesia. And now, the once thriving spiritual capital of Indonesia has become a ghost town.
Jadi Bali itu identik dengan pariwisata ya. Jadi selama pandemi pariwisata benar-benar kolaps, tutup. Masyarakat yang awalnya hidup dari pariwisata harusnya banting setir mencari mata pencarian lain. Jadi saya sebagai orang Bali berharap atau senang sekali ketika pariwisata mulai dibuka nantinya. Nah, tapi di sana juga muncul kekhawatiran apabila setelah dibuka pariwisata tapi tidak diterapkan protokol kesehatan, nanti malah menjadi bumerang bagi Bali, bukannya mendatangkan rezeki, malah mendatangkan bencana kembali.
But at least, growth of community spirit has given some hope to the people that all is not lost, and that the people are still in control of their own destiny amidst the pandemic.
I remember in July, early August, when we see news reports about hospitals' overcapacity, about the lack of oxygen tanks. Indonesians have been very quick to help each other out, to fundraise, to order new oxygen tanks, even Indonesians abroad, right, helping out people within the country. So we see a lot of generosity, we see a lot of people being hopeful, and you certainly see that community spirit, right?
The pandemic has also encouraged Indonesians living in Singapore, estimated to be around 200,000 of them, to help their countrymen back home. More than $1 million have been raised to help provide hospitals in Indonesia with all the necessary equipment to deal with the pandemic. And they include oxygen tanks, masks, generators, as well as an ambulance. The efforts have helped relieve the pressure on the country's healthcare system, which is already bursting at the seams when the brutal second COVID-19 wave spread across many parts of the country.
At the beginning, we're not quite sure who will jump in and chip into this idea. And it is very unbelievable. The ordinary people, the Indonesian domestic workers, try to make any activities, even making cookies, selling to their community. The money that they raise from selling cookies just put in the certain boxes, and then they chip in the fundraising. This is from the Indonesian communities who are living as domestic workers. And then the business persons, it is unbelievable.
Cindy Clarissa Adrian is a Singapore permanent resident. She's been actively involved in raising funds to buy medical supplies for the people in Indonesia. This is done through her community platform, Indotech SG. Cindy is also involved in Indonesia Pasti Bisa, or Indonesia Definitely Can Do It, a fundraising platform to help COVID-19 patients and hospitals in need of urgent oxygen supplies.
We already map out how will we use the fund for procurement and get it delivered, right? The next challenge is, how do we make sure that we are giving it to the right hospitals that is the most critical? So with this, it was really through the help of the embassy and the Ministry of Health.
But Indonesia is also facing a constant battle against myths and disinformation surrounding the virus. There have also been misleading claims that certain products could help cure the disease, even though they're not supported by science. Fahim Yunus is an infectious disease expert at the University of Maryland in the United States. He has become an instant Twitter celebrity in Indonesia, using the platform to dispel myths surrounding the virus in the Indonesian language. For example, he helped counter the claims that eucalyptus or a certain brand of canned milk can cure COVID-19. It comes at the time when Indonesians are seeking a cure for their loved ones who have become seriously ill due to COVID. The Ministry of Agriculture has even promoted an antivirus necklace made of eucalyptus to treat COVID-19. It later reversed its decision after it came under fire from health experts.
I tell people, look, if you want to use that milk and you think it cures you, more power, go use it. Just don't promote it. Because when you promote it, you'll kill and endanger someone else's life. You have all the right to use whichever vitamin, eucalyptus oil. You can drown yourself in the oil. I have no problem. It's your life, your choice. And particularly if you're someone with influence, if you are an important personality that people follow, then you need to be very careful with your words, because you will literally kill people and hurt their lives with your misinformation.
2 years since the outbreak caused havoc in Indonesia, is the worst really over? Or will the pandemic continue to inflict immense pain and suffering to the people of the country? "51-year-old Munaji has been working as a grave digger at Puttu Cemetery in Surabaya for the last 26 years. But never had he experienced the pain and grief when death came suddenly and without a break. That's when he had to lay to rest dozens upon dozens of COVID victims in a single day. In June and July this year, Munaji and his colleagues had to work almost 24 hours a day. They were literally in a race against time, trying to bury up to 100 bodies a day due to the huge rise in the number of COVID-related deaths.
Itu kalau untuk tahun 2001 kemarin antara bulan 6, bulan 7 itu tinggi-tingginya pemakaman. Saya rasa semuanya di seluruh Indonesia lah, termasuk di sini di Puttu. Kita menguburkan sehari rata-rata 80 sampai 100. Nah itu kapasitas kerjaan kita itu dari mulai pagi sampai pagi lagi kita full tim dengan memakam jenazah ini. Jadi kedatangan jenazah itu tanpa henti terus sampai 1 hari 1 malam. Itu nggak tahu hujan, nggak tahu panas, nggak tahu malam, kita laksanakan tugas ini.
His phone never stopped ringing. That's because he had to work round the clock to meet the avalanche of requests from family members whose loved ones died of COVID-19. It's an endless mental and physical challenge for Munaji and his colleagues, having to deal with the tragedy of such a magnitude.
Sebenarnya kalau perasaan itu pasti Mas, sebagai manusia, kita juga ya manusia, kita juga ya punya keluarga. Kadang-kadang kita waktu ada pemakaman, kita ya kasihan, ya tragis lihatnya satu keluarga kadang-kadang habis bapaknya, ibunya, terus menyusul lagi anaknya. Ya kita itu kadang-kadang kita nggak bisa membayangkan, andai kita terjadi kepada kita sendiri gimana. Makanya orang-orang yang nggak ngerti itu seakan-akan itu nggak ada.
Death can come when you least expect it. It can also happen much sooner than we thought. But healing from the loss of loved ones would often take time and require a lot of emotional adjustments and patience. It's been 3 months since 62-year-old Rita Sintanggang lost her younger son, Aldias, and daughter-in-law, Christina, to COVID-19. But until today, Rita remains in a state of grief. She still remembers vividly her conversation with her son, moments after he contracted the deadly virus.
Itu waktu itu kita memang, dia nggak kasih tahu dia itu sakit seperti itu, dia nggak ada apa-apa, cuman aku mau istirahat dulu, katanya mau istirahat. Terus ya saya tanya pada malam itu tanggal 25 itu, "Ma, anakmu sakit?" Bukan dibilang gitu kurang sehat, katanya, nggak dibilang apa-apa. Soalnya sama aku kan juga dia mungkin nggak mau ngerepotkan saya. Anak saya ini nggak pernah mau merepotkan saya. Jadi sebenarnya saya selalu tawarin apa yang kurang, ada yang apa. Mesti saya tanya, enggak Mak, cukup.
She lost her son, Aldias, and daughter-in-law, Christina, barely 4 years after they got married. All the happiest moments turned into a nightmare when they lost their battle against the deadly disease. In spite of her pain, Rita has had to marshal all her strength and courage to get on with her life and rebuild her troubled business. In the neighboring island of Bali, Ida Ayu Surya feels fortunate that she still has a job. But until today, the future of Bali remains quite uncertain. As the pandemic drags on, the likelihood of foreign tourists returning to the resort island in droves is close to zero for now. And that has put immense pressure on the residents who rely on tourism as the main source of their livelihood.
Dulu di awal kan kita masih ada yang masih punya tabungan, saving kayak gitu, paling cuma 6 bulan masih bisa kan. Nah, kenyataannya kan setahun juga berlanjut lagi, jadi memang benar-benar ini membutuhkan dana dan energi yang besar gitu. Jadi ya udah habis-habisan istilahnya. Kalau dulu ya masih ada tabungan lah, masih bisa ini masih ada. Tapi sekarang kan semua sudah kita pakai karena pengeluaran masih tetap, sedangkan pemasukan yang nggak ada gitu.
Over the past year, some 1.6 million Indonesians have lost their jobs because of the pandemic. and nearly 3 million more people have fallen below the poverty line. Growth outlook for Southeast Asia's biggest economy looks set to worsen, and that has hit ordinary Indonesians pretty hard.
Poverty has existed before COVID-19. COVID-19 makes it even worse, right? The pandemic always exposes all these weaknesses, all these challenges in society and escalates it to the next level.
80% of Indonesian population, they are poor, they are worried. If they don't get physical activities, they will not have money to live. So the president and the team is looking for a balance, how we can still protecting the people.
But of late, Indonesia's government appears to have shifted its focus in its battle against COVID-19. It's now more prepared to get the population to coexist with the virus while accelerating their vaccination efforts. But the problem is, Indonesia is still struggling to reach herd immunity through vaccinations. Less than 30% of the country's 270 million population are fully inoculated, far below the government's target of 70%. Will the government be able to meet its vaccination targets and make the endemic phase possible?
I haven't promised the president that we can do it in a year because you have to understand the original plan is to deliver 363 million. But we are working very, very hard to do it. Thanks to God, we are passing the peak already.
They will achieve the target if you only count Java. I don't think they will achieve the target in outer islands or outside of Java until they fix the management and distribution of vaccines. Look at the case of Sulawesi. When vaccines are delivered, the first people who get them are people close to power, the officials and their families and their friends. They even can get the third jab. So formal systems fail to work. And that's why the lion's share of vaccines we see is going to Jakarta or places where the elites live, while the masses outside the cities, outside Java, must wait for their turns.
At the moment, there are ample signs to indicate the number of infections is falling rapidly. After overtaking India as Asia's COVID-19 epicenter in July, Indonesia now has the least number of daily infections per capita in the region. From a high of around 57,000 daily cases during its peak in July this year, it has now fallen to below 3,000 cases daily. And now, the government is looking to bring in foreign tourists back to Bali, following a steep fall in the number of cases in the resort island, but subject to strict health protocols.
Harapan saya sendiri sih sektor pariwisatanya segera pulih, jadi kayak wisatawan, airport segera dibuka, jadi kita segera bisa menerima kunjungan wisatawan. Dengan itu ya kemungkinan dari sinergi dari beberapa pihak, pemerintah, jadi mereka sudah bisa istilahnya mungkin semua daerah sudah divaksin, dipercepat vaksinasinya, jadi dari luar juga istilahnya kalau memang kita sudah divaksin semua, mungkin dari luar kayak mancanegara itu sudah mengizinkan warganya untuk berkunjung ke Indonesia dan ke Bali.
But has the time really come for Indonesia to open up? Will it be courting danger by opening the economy too soon while the vaccination efforts are still ongoing?
There's no way to open the economy if your virus is spreading. So that's pretty simple. If you're having dead bodies floating in the river, good luck. Good luck opening a business. Nobody's going to go on that aeroplane. Nobody's going to come out. People will be afraid. So we have to understand pandemic takes the first step in the sequence. You have to control the pandemic in order to open the economy. There's no other way.
only a few weeks after the worst of the pandemic, Indonesia is starting to open up again. It's starting to lower down restriction levels for Java and Bali as the center of of economic activities. So we're seeing a government that's really keen to meet its economic targets. The question is, at what cost, right? Experts are warning now, and we see it in news reports, that the Jokowi government has been accused of opening up the economy too early, opening up restrictions too early, and we can only hope that the worst is indeed behind us, because we don't know that for sure.
COVID-19 has left a devastating impact on the lives of peoples all across the globe. Tens of thousands of people have died from the disease. Millions of workers have lost their jobs. Livelihoods have been disrupted and destroyed, and Indonesia is no exception. More than 4 million people have been infected so far, and over 140,000 have died from the disease. Munaji can only hope that the rise in the number of COVID-related deaths will stop once and for all, and that life will return to normal again soon.
Kalau angkat sampai sini kudu nangis, Pak. Saking beratnya kita ingin berdoa. Ada yang kiai, saya minta doa. Ada pejabat sini, saya minta doa. Doa apa? Doa cuma dikuatkan teman-teman ini. Dan doa saya supaya dikabulkan kan yang buyar dan cepat selesai lah pandemi ini. Jadi tetap kita, alhamdulillah, kita bisa sampai saat ini. Tentu saya bilang tadi teman-teman semua, alhamdulillah sehat semua sampai saat ini dengan doa-doa masyarakat semua ini.
That's also the wish of millions of people in Indonesia who feel that they don't have to go through the pain, trauma and sufferings of those who've left before them.
So I want people to know that this is a temporary phase. This will end, but if you work together, it'll end sooner. How soon it ends, it's in our control. It should not be in the virus's control. I think for all those who will survive and remember this, you have an absolutely beautiful story to tell your grandchildren, because 30, 40 years from now, when people will talk about this pandemic, you'll say, yeah, I've lived through it. I know how it feels.